Time now for Morning Rounds with CBS News Chief Medical Correspondent Dr. John LaPook and CBS News contributor Dr. Holly Phillips. First, a potentially deadly superbug turns up at a second Los Angeles hospital. Cedars-Sinai Medical Center blames the spread on a contaminated medical scope. The same type of device led to an outbreak at the UCLA Medical Center. It infected at least 7 people between October and January. John, another hospital, same medical device. How concerned should we be?
I'm very concerned about this one, and usually I'm very relaxed about things, but I think this is just the tip of the iceberg. And what concerns me the most is you have these 2 very good institutions who followed protocol according to themselves and according to the investigation, and yet they still got the infection from these scopes. So that says to me that there's something wrong with the protocol.
Well, he mentioned contamination, Anthony. So is this an issue with the design of the scope or just the way it's being disinfected?
Sure. Vanita, the thinking is that it's actually both. The scopes have very small, intricate parts on the end of them, and those parts can harbor bodily fluids and bacteria, and it makes it hard to actually clean the scopes really as thoroughly as they need to be. But just as John mentioned, the hospitals involved had followed the recommended protocol, so now it's about looking at that protocol and seeing if it's enough.
All right, so that's the next step here as we figure out, obviously something's got to change.
Oh, I think all over the country right now, medical centers are going back over their records and saying, was there some association that we didn't realize was happening? The only really reason why they figured this out was that when CRE, the superbug, gets into your bloodstream, it's got like a 50% mortality rate. So it just leapt out at them. And now other places are going to be looking at their records and saying, well, what about less deadly organisms? There's a lot of gut bugs, E. coli, Klebsiella, that aren't superbugs. Are these being contaminated? And then I think you also have to look at the role of the FDA. The CDC told the FDA in October of 2013 that there was a problem with these scopes, and it seems like that took a long period of time really for anybody to sound the alarm. So I think in the days and weeks and months to follow, this is going to become a bigger story.
Well, now to the growing controversy over testosterone-boosting drugs. This week, the FDA issued new label requirements for these products. It's amazing. Everyone knows what low T is now. We've all heard that term, but what really does it reference?
Well, low T represents testosterone. Now, testosterone is a hormone made by the body in both men and women. Men make more testosterone than women. And the testosterone levels start to decline naturally around the age of 40. Now, way back in the 1950s, testosterone therapy was developed for men who had medical conditions that made it difficult for them to make enough testosterone, and that's what it was used for. But in the last 10 years, it's been marketed really aggressively and used really focused on the problems of aging, things like low libido, fatigue, or muscle loss. And many times, it's used in men who don't even have low testosterone.
So, John, what is the FDA now requiring from these manufacturers?
Well, for one thing, a label change. They're going to say first, look, here are the indications. And as Holly was pointing out, it's not just that you're getting a little older and your number is dropping. There are specific indications. 2, what are the potential risks? Heart attack and stroke. And 3, because there are some questions about exactly what the risks are, they're encouraging the manufacturers to go out and do studies. And I found something very interesting. They are saying, we encourage you all to do this together. It'll be a lot easier and more effective and more statistically significant to do it as one big study.
You mentioned risks, though. It looks like 2 studies are saying there was no increase of heart attack, and there was no, I should say, risk of heart attack, and no stroke with testosterone therapy. So do you think the FDA may be overstepping?
No, I think what they're doing is absolutely appropriate. Really, Vanita, the jury is still out. It's still not entirely clear what the long-term risks are or whether there are long-term risks. But the jury is also very much still out about whether there are any benefits. It's not clear that it makes you live longer or that it actually really does turn back these signs of aging. So we need more research both on the risks and the benefits before we go ahead and use it this way.
Next, there's some good news for those of you sipping on a cup of coffee this morning. A new study found moderate coffee consumption can be good for the heart. I like this news, Holly.
Of course. This is a very large study. They looked at 25,000 people around the average age of 41. And to make it very simple, they looked at how much coffee they drank, and then they did a CAT scan on them, a special type of CAT scan that looks at something called a coronary artery calcium score, which is thought to be an early indication of heart disease. It turns out about people who drank hardly any coffee, 1 or less cups a day, and people who drank a lot of coffee, 5 cups a day, had the highest coronary artery calcium score. So they had the highest risk of heart disease. People right in the middle who drank between 3 and 5 cups a day had the lowest risk. So 3 to 5 cups a day in this study seemed to be the magic number.
So in news that affects me, I feel like I should have another cup then. Is that what I'm hearing?
We have done these stories, one after the other, right? These stories where drinking coffee may help with Parkinson's, it may help with reducing the risk of diabetes or liver disease. And whenever I speak to the authors about this, they all say the same thing, which is don't start drinking because you want to try to do better in terms of the risk profile of these conditions. But it's nice and reassuring to know that if you're already drinking, that not only is it not a risk, but there's potential benefit. Now, of course, you can have side effects from coffee. You can get jittery, and we say, 400 milligrams of caffeine a day is usually the limit after which you start getting a little bit jumpy.
Well, if you're not a coffee lover but still want to help your heart, go nuts. A new report found eating peanuts and tree nuts could be associated with reduced risk of heart attack and stroke. Researchers caution against eating too many, in particular salted peanuts, because they're high in calories.
Finally, it's here again. Most Americans spring forward into daylight saving time tomorrow, losing an hour of precious sleep in the process. According to one survey, this means a tired and cranky start to the work week on Monday. The survey found 61% of Americans feel the effects of the daylight saving shift. 40% say they needed a week or more to get back to normal, and 39% reported they were in a worse mood following the time change.
I'm cranky already.
It takes me about a month to get better. But it's also not just how you feel. There are medical effects. There's a 5% increased risk of heart attack during the first 3 days after the spring time change. So it could have very wide-reaching effects.
Wow.
61% cranky, that is Monday, right?
Right, yeah, that's the standard.
Dr. John LaPook, Dr. Holly Phillips, thanks so much.